I'm Sang-hee Moon.
And my name is Hannes de Vos. Sang-hee is a PhD student, and I'm an assistant professor in the Department of Physical Therapy and Rehabilitation Science at the University of Kansas Medical Center. We are excited that our study, entitled Comparison of Unsafe Driving Across Medical Conditions, will be published in an upcoming edition of Mayo Clinic Proceedings. We would like to thank our partners in this collaborative effort. They include Dr. Abiodun Akinwuntan. He's the Dean of the School of Health Professions at KU Med Center. Dr. Ranchet from the French Institute of Science and Technology for Transport, Development and Networks, and Dr. Tans from the Belgian Road Safety Institute. A special thank you as well for the Belgian Road Safety Institute for funding this research. Driving is one of the most important means of transportation for people living in industrialized countries. But a variety of medical conditions can affect a person's ability to drive safely. Therefore, it is important to be able to identify those medical conditions that can cause unsafe driving and ultimately result in fatal crashes. In our study, we looked at roughly 6,600 drivers who underwent a formal driving evaluation in Belgium. We used 4 outcome measures of driving safety. The first outcome measure was a recommendation of the referring physician who made his fitness to drive recommendation based on a driving and medical history with the patient. The second outcome measure was the comprehensive fitness to drive decision, which was a decision based on medical information, visual information, and results of cognitive and on-road test results. The third outcome measure was a number of motor vehicle crashes in the past 5 years. And finally, the fourth outcome measure was a number of traffic violations in the past 5 years.
74% of study participants reported a neurological condition as their primary medical condition, followed by musculoskeletal, psychiatric, and cardiovascular or pulmonary conditions. Although neurological conditions comprised the majority of the study participants in our database, they were not most likely to fail the driving safety assessment. Statistically, drivers with psychiatric conditions or substance abuse issues were at the highest risk of unsafe driving. About 25% of participants with psychiatric conditions and 20% of those with substance abuse failed the formal driving safety evaluation. We think this overestimation of a patient's actual fitness to drive may be due to several variables, including vague legal standards for driving fitness, a lack of accurate screening tools, and finally, a fear that a negative report might jeopardize a doctor's relationship with his patient. We found drivers with psychiatric conditions and substance abuse to be at higher risk of unsafe driving. As a result, we believe doctors should be more cautious when assessing the ability of these patients to drive safely. We found different outcome measures for driving safety reflect different constructs of unsafe driving. These differences should be appreciated and acknowledged by doctors and driving rehabilitation specialists when determining a person's safety to get behind the wheel. It is extremely important for patients to be aware of how their medical condition can affect their ability to drive. This is of particular importance to drivers with psychiatric conditions, substance abuse issues, or other medical conditions that put them at higher risk of unsafe driving. These drivers should work closely with their doctors or a driving rehabilitation specialist when establishing their safety to drive.
As we continue our research into driving safety, we would like to examine the effects of comorbidities on the risks of unsafe driving. In addition, we found that age was a confounding factor. So it will be interesting to investigate how aging affects a person's fitness to drive and what the associated risks might be.
Lastly, we would like our research to help develop more detailed and uniform guidelines for driving assessment, support the development of more accurate screening tools, and help to reform government policies and regulations surrounding medical conditions and a person's fitness to drive.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.